3 News has been following the Coastal Bend veteran-based nonprofit Burn Pits 360 for years, watching the movement start at its grassroots level, gain national attention, and move to Capitol Hill. The group advocates for health care for our nation's heroes exposed to toxic burn pits, commonly seen in images of war in Iraq.
And this morning, Burn Pits 360 is at our nation's capital, hoping to get a bill passed through the House, continuing their efforts. To explain more, we have 3 News reporter Jalissa Garza joining us live in the studios with what this measure means and what we need to pay close attention to. Jalissa.
Well, Burn Pits 360 is just one of several groups looking to pass legislation through Congress. This specific bill is H.R. 3967, also called Honoring Our Pact Act. It would speed up health care coverage and compensation for veterans exposed to burn pits, toxic chemicals, and other unimaginable items.
During military times, they took all the waste that was on the base, everything from computers, blown up Humvees, amputated body parts from the medical hazardous waste, paint, anything you can think of, was burned, doused with jet fuel, JP8, and burned 24 hours a day.
Toxic exposure in the military is something an untold number of veterans have been impacted by, such as Rosie Torres and her husband Leroy, an Army reservist who was stationed in Iraq and was exposed to these harmful chemicals. The Torreses knew they were not alone in their health needs, so they created Burn Pits 360.
We had to create a place where we could all just unify and create a national message to address the injustice.
The exact number of those affected by waste burn-off is still being calculated, but the number of active burn pits has decreased.
There's 9 active burn pits, right? Before there was hundreds, but we, through our effort, have been able to minimize that number down to 9, but still not enough.
Torres says there is still more work to be done. Right now, their focus is on getting the Honoring Our Pact Act through Congress. Without this bill, Torres says veterans would still be left to somehow pay for extensive health care for themselves.
You have to be your own advocate, your own lawyer, your own researcher, your own doctor. You have to travel at your own expense to try and get specialized health care to help find a physician that will validate that whatever illness you're experiencing is a result of toxic exposure.
If the bill is approved in the House, it still has to go through the Senate, which is why the organization is asking you at home to call your representatives and help support this bill. Of course, we're going to continue following this on air and online, so just be sure to stick with KIII TV. Barbie, John Thomas.